Hello, welcome to Healthy Kingston. I'm your host, Janet Wade. We are all familiar with the fact that the past year our lives have been consumed by the coronavirus pandemic. But there's also been another epidemic that has impacted all of our lives over the past 20 years. And it's become even increasingly significant because of the coronavirus pandemic. And that is the opioid epidemic. So we will be devoting a large percentage of the program today to the opioid epidemic, its impact on the area, and how we as citizens can deal with it and find local resources for loved ones of ours or family members, neighbors who may need them. But before we get further into that, I would like to introduce you again to our monthly guest, our health agent, Dr. Marcia Hertzberg, who's going to be speaking to us about the coronavirus and the cases in town, and also about the resurgence of ticks in the area. So with that, Marcia.
So for COVID, we, like many other towns, have seen an increase in cases. People have COVID fatigue. It's been spoken about quite a bit. We have, the state has an increase in the UK variant. It is 30% of the cases in Massachusetts at this time. That's the B117 variant. And in the year to date, we have 1,285 cases as of Tuesday, this last Tuesday. And since the 15th, we have had 37 new cases that just came up. So that's pretty significant. This is interesting. As you know, we've had people getting vaccinated. And what's significant is that we're seeing the population where the majority of people have had their vaccinations, 55 and older, where we're having very few cases, and that's very positive. In the demographics where people are just starting to get vaccinated, we're still seeing that those numbers, people are still reporting cases, but we're seeing a lot of cases in the 20 and under demographic. More than half of our cases are people that are 20 and under at this time. We're also noticing a trend in family transmission, where we're seeing 2 or more people in families that are presenting as positive, COVID positive. So it's running through families, which is significant. So this is something where one member is getting it, and then another, and then another, and it's taking time as it's going through. I'd like to remind business owners that if it goes out into your business, you are required to notify the Board of Health immediately when you have a positive case, and we'll walk you through what you need to do in order to protect your workers and the public.
Okay, thank you. Next, it's that time of the year. Ticks are becoming prevalent. If you could speak to that, please.
Yes, ticks are becoming prevalent. Our MAVEN, as I spoke about, which is the state system for reporting infectious diseases, we get notified of different diseases, and we have been getting reports of several different tick-borne diseases. We have several cases of Lyme's disease, and we have a case of Rocky Mountain spotted disease as well. What's important to note is that it is the time of year when we'll start to see these. The weather is getting, is becoming nice. One of the things that we are doing is we are calling for people to become aware. We've updated our website. We've put a lot of information there that people can go and look at. It tells you information such as how to protect yourself against contracting tick-borne disease. It will tell you the different types of ticks, what they look like, what type of symptoms that are presented by different types of ticks. And it will give you information from different formats. We have some YouTube videos that are up there. We have links to the CDC, to the state websites. We are additionally having the fields at the schools are going to be sprayed to protect the children, as well as our recreational sites to help protect the people that are using them for recreation. One of the things that I wanted to mention is some of the easy prevention to wear long socks, long sleeve pants, long sleeve shirts, and they recommend that you use insect sprays with DEET. These are things that you can do when you go back home to immediately look and do tick checks so that you can see if you have any ticks. So these are all things that you can do. Another thing that's important to keep in mind, people will automatically think of Lyme's disease. It is very prevalent, but to be aware also that a single tick bite can be associated with multiple infections. They've done studies that that have shown that 60% of tick bites are associated with multiple infections. These are viruses, parasites, and bacterial infections. So it's important to go and have blood work done to make sure that you're properly treated for all the possible diseases.
Okay. Well, thank you. Again, a lot of good information. The takeaways there would be it's the time of the year, late afternoon, early evening. If you're going to be outside, take precautions, use insect spray with DEET, long sleeves, long pants, socks. Check yourself when you come in to the house, check your pets, make sure that you're tick-free. And if you do get ticks, that you remove them immediately from yourself or your pet. If you see any signs of infection, redness in the area, warm to touch, a fever, that to report it to a physician.
That is correct. And pets are, and pets can be protected. It's important for people to be aware that pets get very sick from tick bites too. So if you do find them on your pets, make sure that you notify your veterinarian as well. We do have a CDC link that shows you the proper way to remove ticks. There is a lot of old wives' tales that are out there on how to remove them that are not accurate. So please check that out for the proper way to remove them so that you don't end up with the tick's head left in your body.
Okay. All right. Thank you. As I had mentioned in my opening remarks, we're going to be devoting a lot of the program today to the opioid epidemic. And I'm very pleased to have the opportunity to introduce to you a local woman who has been very involved with opioid abuse and dealing with here in our community. Her name is Sarah Cloud. She is the director of social work at Beth Israel Deaconess Hospital in Plymouth. And she comes to us with dual masters in business as well as social work. Many of you may be familiar with her and that she works on many local boards in the area, particularly in the area of opioid abuse and psychiatric issues. She also is an author of a children's book and another one to soon come out that have to deal with grief and loss that children go through whose parents are affected by opioid abuse. So she has a lot to enlighten us about, and I'm very excited to have her here. So welcome, Sarah. It's very great to have you here today. If you would, could you tell us a little bit more about the extent of the epidemic here and how it's impacting Plymouth County?
Yeah, no, certainly I'd love to. Plymouth County area in the South Shore of Massachusetts has been heavily hit by the opiate epidemic, and we've known that for quite a few years now. And I started practicing in this area about 6 years ago, and one of my first introductions to doing community work outside of the hospital was with Chief Boterri in Plymouth, inviting all the community stakeholders to the table and saying, we've got a really significant problem here. We're seeing it all the time. We're going out on all of these overdose 911 calls, and we really need to do something. And so what we piloted together was a program similar, replicated to what Gosnold was doing down the Cape, in which they were going out to people's homes following an overdose the next day and trying to re-engage the individual and the family, because the family is such an important piece of, they're deeply impacted by what's going on. It's not just one person that's, in active use and struggling and living with opioid use disorder or substance use disorder. The entire family is impacted and needs support and treatment as well. And so we started doing that December 1st of 2015 in the town of Plymouth alone. And it was such a huge success. Success is measured by not one person turned us away at the door. So it was a recovery coach, a social worker like myself, and a plainclothes officer going out and knocking on the door the next day. And so not one person turned us away at the door, and such a high number, I think it was like 85% or something in that first year in the town of Plymouth alone said, yes, I do want treatment. And we were able to get them linked to treatment right there from that visit. Sometimes the plainclothes officers are driving them to the treatment facility as well. So other towns, including Kingston, was a very, very quick and early adopter of the program. So we quickly expanded, and to date, 5-6 years later, the entire county, so all 27 police departments plus the Bridgewater State University's police department, so it's 28 in total, are all participating in this program called Plymouth County Outreach. And we've also had the opportunity to consult to other parts of the state of Massachusetts, as well as other parts of the country, on how to implement a similar program, or something that might work for them in terms of the community follow-up. With that program, we're also able to track very closely trends and data on use and impact of the opiate epidemic over the past 5 or 6 years. And the annual report for 2020 was just released earlier this week. And I think there's even some newspaper articles about it too that folks can find if they'd like. And one of the things that is really important for me to kind of share with the community is that naloxone or Narcan, and I have some here to kind of show people what it looks like. It's a nasal, very much like Flonase, that you just goes up the nose very easily, has saved 93, was used and saved 93% of the folks that had a 911 call because of an overdose. So 93% of the time in which it was administered, it saved the life, it reversed the overdose, and the person was able to be safely transported to the emergency room, monitored for any concerns of the occurrence happening again, and linked and offered treatment. And so 29% of that time, so in 241 times, it was a bystander, a family member, somebody in the community knew about Narcan, knew how to use it, and had it available to them. 241 times saved a life on their own.
That's
so
impressive.
One of the really big things that we can do as a community, whether we know somebody in our life that's struggling with addiction, because most people do know somebody. And even if they don't know somebody, it's like CPR, you don't know when you're going to need to use it, but you need, but when you do, it's life-saving. So it's really simple and easy to use. It's really simple and easy to get, and it saves lives by getting somebody to start breathing again and almost immediately. And when there's breath, there's hope. Then we can try to continue to offer support and treatment and linkage to treatment, because we know treatment works and is highly, highly effective. And I think one of the greatest barriers to treatment, and one of the things that cause the most death and the fatals, is the amount of stigma and shame associated with substance use disorders, and particularly the opioid use disorder. A lot of people hide it. A lot of family members may be aware, concerned that the family member is using, but either don't know where to get treatment or are just tremendously ashamed. And I just really, I think the more work we can do, reach out to the community, talk more about this, I think more we can address the stigma and the shame and get people connected with the support and the treatment that they know that's life-saving.
Right. Absolutely. Taking a step back, the Plymouth County outreach team that you're involved with, very impressive. I'm sure it sends an incredible message to the client as well as the family, that the community cares and wants to be supportive of the person. And can you speak, you said that a number of people, of the large percentage of the people that you've spoken with have all sought treatment.
Yeah, so again, referencing the 2020 data that just came out countywide from those visits to the home following an overdose, 75% of the folks were linked to treatment from that visit, and another 11% were already in the process of seeking treatment themselves.
That's phenomenal.
So to talk a little bit about, just what the process might look like, or does look like, there's an overdose, 911 is called. Hopefully in a lot of cases, as I said, 248 times, somebody administers Narcan as a bystander or loved one or family member. EMS and police arrive, they administer Narcan, naloxone, they transport the person to the closest emergency room. Emergency room monitors the individual for a couple of hours, making sure that they're safe, that the opiates aren't going to cause the overdose again, even if they don't use again. People can go back into the overdose, so it's really, really important to seek medical treatment and not just administer Narcan. And then we have a team of social workers and recovery navigators and other addiction specialists in our emergency room, where we want to offer treatment. We want to engage them. We want to link them to treatment directly from the emergency room. But a lot of folks who've overdosed are reluctant to do that. You think about it, they're using opiates one moment, the next moment they're waking up, frightened, probably sick, embarrassed in an emergency room. And so they didn't come here seeking treatment. So they're very anxious to leave and want to leave. And so with so many people leaving against medical advice following an overdose and going back out into the community is exactly why we developed and partnered with doing this Plymouth County outreach and doing these follow-up visits, because in their own home, they've had a little more time to think about it. They don't maybe feel trapped. They don't feel, observed or, whatever else negative feelings they might be feeling following the overdose. And we just have this opportunity to sit down around the kitchen table or, outside, wherever is most comfortable for them, and have a talk and with somebody has lived experience. A lot of these recovery coaches and navigators that we work with are in long-term recovery themselves. They know exactly what it's like to have been in that situation, in that place, and what it feels like, and connect with them on a level that I think treatment providers don't quite have the ability to do so, and link them to treatment. So I think it's just really successful. Also in the emergency room, we don't have access to the families most of the time.
Okay.
And so being able to support and engage the families is also, I think, a game changer, because they're living this alongside their loved one. They are deeply affected, and I think they have probably a lot of ways in which they don't necessarily know how to how to support and how to help them, and a lot of shame and stigma, and times feeling, I think a lot of parents feel guilty as they shouldn't. It was not something that they had done that created this. So I think having that support and being able to link them to treatment and services as well has been really helpful.
With people who have repeatedly overdosed, do you continue this cycle of going out and visiting them, or is this a one-time only thing?
Never, that's a great question. Never one time. Always are hopeful and will continue to work on it. We actually have found that there's such a high percentage of folks that overdose multiple times in the county that we've actually identified or established a new program called the Tier 2 through this partnership, in which we know who those folks are that overdose 3 or more times within a 6-month period. We know they're at much higher risk of having a fatal overdose. And so we have a team of recovery coach, social workers, specialists that try to specifically engage them even when they're not in the midst of an overdose or following an overdose, and try to work really closely with them and provide them support and treatment too. And I think with some pretty good success rates.
Where can the lay person, the average citizen, obtain Narcan?
Yes. So it can be obtained. They have a standing prescription at all pharmacies in the state of Massachusetts. So you no longer need a prescription for Narcan. You can walk into your pharmacy and ask for it. It's a standing prescription. And the cost is what the copay would be on your insurance. It comes in 2 packs with 4 milligrams. I see I have a pack here. The other way in which to get Narcan, if people aren't comfortable walking into their pharmacy, which is understandable, or maybe don't have the copay or the insurance to cover it, there are many organizations that are happy to provide the Narcan kits and the training as well. And one of those organizations is called PCO Hope. We are a secondary distribution, PCO Hope, to BAMSI in Brockton. And so we have hundreds of Narcan kits to be able to distribute throughout the community. And so I know I had provided you their contact information and a link. And so people click on that. PCO Hope also has a social media presence. So people can get on that, our Facebook page. They can send us a message through PCO Hope. We can either meet with them, virtually, or drop off Narcan and make sure that we're getting that out into the community.
Just taking a step back before it gets to the point where people overdose and need Narcan and further treatment. What would you suggest for a family that is wrestling with this, with a family member who wants to seek help for their family member before it becomes a life-threatening issue?
Great question. And I think there are many avenues in which to do this. My number one go-to is always support groups. I think it's really helpful and comforting to know that there are other people, other families that are going through the same exact thing. And I think the connection with them, with other families that are dealing with this, is incredibly powerful and reassuring. And I think the advice that you can get from other families that are going through this or have been through this, it can be really, really powerful. So there are a number of support groups that are good. Learn to Cope is amazing. They also distribute Narcan and do Narcan training. Family Restored runs a group right here in the Duxbury Kingston line called the Addict in the Family. That is a really good. They're also offering it as a virtual option right now. But the other piece too is early on when we started the Plymouth County outreach and the follow-up visits, we did hear from families, and families said, why do we have to wait for an overdose in order to get help? Mm-hmm. And so PCO developed what we call an at-risk option. So believe it or not, I know this feels contradictory, but anyone can call, and anyone in Plymouth County can call their local police department and say, I'd like an at-risk follow-up visit for PCO. And so that same team that follows up following an overdose can come out to your home, or, you know, wherever, however setting you're most comfortable without having had an overdose, and get the same type of service.
Oh, that's wonderful.
Connection,
That is
treatment.
wonderful.
Yeah.
Terrific. And they would contact the police department to
Local
get that
police
service.
department and ask, yep, and say through Plymouth County Outreach. Again, in Plymouth County, Kingston Police Department, as I said, has been involved very early on in the development of this program, and it continues to be very involved as well. From my perspective and years of doing this work, it is a disease. And so I think leaving the judgment, thinking this is a character flaw, and leaving that out of it is really, really important. I think it only fuels the stigma, which is the main reason which I think people are dying. But here are other ways in which people are overdosing and why Narcan is so important. You know, if somebody's prescribed pain medications, they've had a serious injury, they're a tremendous amount of pain, they're trying to chase that pain. They might be taking more than they actually intend to or prescribe, with not understanding what the consequences could be. They're simply trying to treat the pain and make the pain stop. So that person does not have an opiate use disorder or substance use disorder per se. But they're overusing opiates in a way that is dangerous and life-threatening without intending to be. So that's why it's really important for you to have Narcan, because that overuse of pain medications to stop the pain can cause a fatal overdose that can be reversed with Narcan if administered soon enough.
Right.
You know, I think another population that we see of unintended overdoses is people older in age that might get confused about how to take their medications and whether they have taken their medications and they're taking them again. Again, not intended or anything I'd classify as an opioid use disorder or substance use disorder, but it will result in a situation in which Narcan would save their lives if that were to happen, and it does happen often enough. So I think there's so many reasons why it's just helpful for people to have Narcan available, know how to recognize the signs of an overdose. Important to call 911 first before anything else, and let them know that we think the person has stopped breathing, and then to administer the Narcan. And people will be on the way to help, either bring additional Narcan if it's needed, help perform CPR, and get that person to treatment. So it's life-saving, and you never know when you're going to need it.
Absolutely. Well, thank you so much. The information has been tremendously valuable, and the community is fortunate to have you and like-minded people who are helping us wrestle with this. Thank you very much.
Thank you.